welcome everybody again to our booth lectures. Today we have two wonderful conferences. We have Dr. Margarita Cabanas from Sevilla, Spain, who will be talking about a study she's conducting on precision, toric, and irregular corneas. And then we will have Dr. Im from South Korea, who will be sharing with us his experience with Artiplus, our newest member in our portfolio. So first of all, I would like to welcome and thank Dr. Margarita Cabanas.
Thank you, Ursula. Thank you, OFTEC, to consider me to stay with you today. Good afternoon, everyone. I hope you hear me well because I can't hear anything. So if there is any trouble about the sound, please let me know. My name, how Ursula says, is Margarita Cabanas. I'm the head of the ophthalmology department of the University Hospital Virgen del Rocío in Seville, in the south of Spain. Let me show you the interesting work we are carrying out in our workplace. We are evaluating the results obtained after the implantation of conical toric intraocular lenses in cataract patients with asymmetric and irregular astigmatism cornea. The aim of this study is to assess the refractive and visual outcomes, as well as the safety and stability of precision transition toric IOL implantation in a series of cataract patients with stable, asymmetric, or irregular corneal astigmatism. We must emphasize that stability is an essential condition. As we know, toric intraocular IOLs implantations has been widely used to correct astigmatic ametropies with good efficacy, safety, and visual outcomes. Until now, this technique has been used with good results in healthy corneas with regular astigmatism. How do we define irregular astigmatism? We talk about irregular astigmatism when principal meridians are separated by an angle other than 90 degrees or different distribution of power across a single meridian. There are many possible causes of irregular astigmatism. Some of them could be traumatic of post-surgical leukomas or of scars, decentered previous LASIK surgery, keratoconus, previous keratoplasty, or others. How can we address irregular astigmatism in the context of a cataract surgery? Talking about corneal astigmatism, we could say, fortunately, that most cases are regular astigmatism, and we can solve them safely with corneal ablations or toric IOLs. On the other hand, the opposite will be astigmatism with a high irregularity, in which we have no doubt about performing a procedure to regularize the cornea before considering a toric lens or other refractive procedure. And in the middle will be the group of patients in whom, in this occasion, we are interested, those in whom mild or moderate and, above all, stable irregular astigmatism appear. So, which are the inclusion criteria for our study? We selected adult patients with cataract surgeries with previous diagnosis non-progressive corneal condition, like we saw before, and with topography finding of mild to moderate irregular or asymmetric corneal astigmatism. And what does that mean? That means that the difference in corneal power between the two principal semimeridians is between the range of 1 to 5 diopters when we measure at a radius of 1.5 millimeters from the center of the cornea. Or the two steepest semimeridians are at an angle to each other within the range of 10 to 30 degrees. Another inclusion criteria are corrected distance visual acuity more than 20/50, maximum keratometry value of less than 50 diopters, clear central cornea and ocular media, except of course for cataract, corneal thickness at least at 400 microns at the incision site, scotopic pupil less than 6.5 millimeters in diameter, endothelial cell density greater than 2,000, and in general, good ocular health. Here are some of our cases. On the left side, you can see an irregular astigmatism from an old leucoma. On the right side, you can see another one after a pterygium surgery. And you may be wondering, why did we choose these lenses? We chose this IOL because considering its optical design, the tolerance range for low irregularity, we think that could be better than others. This is mainly due in two circumstances. One of them, the aberration-free asphericity, and on the other hand, the transitional cone that guarantees the selected power from the center of the optic to the periphery. These two circumstances make this lens offer us extra safety in all the cases of astigmatism, even more so in astigmatism with low or moderate irregularity previously described. In this toric lens, asphericity is calculated meridian by meridian, allowing to have a better tolerance for rotation, corrects distortion phenomena, and makes it more pupil independent. And different studies show it in the scientific literature, like in this one, in which we can see how the conic toric lens maintains better contrast despite the misalignment compared to other types of toric lens designs. Or this other one, in which we see how the rotation of the lens induces less loss of the cylinder correction effect. And I'm thinking now that maybe it's time to tell you what we are finding in the preliminary results of the patient that we have operated on. You should know that although we will include 20 eyes in the study, these results are from the first 6 patients. In the descriptive data, we can see that the distribution by sex is quite similar, and the mean age is over 70s. And we will highlight the range of preoperative astigmatism power, which is between 2.4 and 9.9. Until now, visual acuity has improved significantly in all our patients, with a minimum follow-up of 1 month after surgery. We have detected minimal rotations without clinical relevances, and it wasn't necessary to rotate any lens. And the postoperative refractive adjustment has so far been optimal, both in the sphere and in the cylinder correction. In conclusion, we can say that moderately irregular astigmatism can be corrected at the time of cataract surgery with good results. Precision toric IOL yields good visual and refractive results in these patients with excellent rotational stability. The conic toric design of this IOL seems to be a good option for patients with moderate and irregular astigmatism. Obviously, we need to complete our study before we can speak properly, but our first impressions are excellent, and we believe that we can provide an important benefit to a large number of patients for whom, until now, we have not offered an adequate solution. So thank you so much. I hope you are interested.
Thank you very much, Dr. Cabanas. Is there any question for the doctor? No? Well, I think it was a very interesting presentation and nice to see how these patients with irregular astigmatism have now an option for their cataract surgery too. Thank you very much, Dr. Cabanas.